there, I'm Jen and this is Teresa.
Hey.
We're here today to talk to you a bit about kids and Lyme disease. So how do kids get Lyme disease? Well, there's a couple different ways. Kids can get it from ticks, really any blood-sucking insect, such as mosquitoes, bed bugs, even head lice. There also is evidence that Lyme disease can be passed down from mother to baby. We don't see this all the time, but that is something that does happen, in fact.
Yeah.
So Teresa, tell us a little bit about testing.
Yes, testing. That's really a difficult subject for kids or for adults, actually. The standard test for Lyme disease starts with an ELISA. And the CDC tells us if you get a positive on that, then we will test you with a Western blot. The problem is the ELISA really misses a lot of the cases, so it's really not considered gold standard, even though it sometimes is treated like that, unfortunately. If you come back with a positive on that ELISA, then your doctor will run a Western blot. And in that, we are looking for specific antibodies that are responding to the Lyme disease bug, which is called Borrelia. Now, that test looks for one strain, Borrelia burgdorferi, which is the most common strain. However, if your child were to have a different strain and got a negative on that test, doesn't mean that it's not there. It could be a different strain that they got. So the testing is a difficult thing. The nice thing with kids is that they tend to, their immune systems are more responsive than adults. So they will often get a positive result way more often than the adults do. So it's a good place to start. Mm-hmm. And, but if you got a negative, but you're still very suspicious that it's there because there was a bullseye rash, or the poor little guy's got headaches and belly aches and behavioral issues and sleep problems that they never had before after a tick bite, then there is more sophisticated testing that's very expensive. IGeneX is a good lab, DNA Connections some physicians like, and Vibrant America. And so a lot of those you would have access to through a Lyme literate medical doctor. Mm-hmm. And there's several in town who will run that testing if that's something that a parent would want. The other thing we were going to talk about is antibiotics. Mm-hmm. Are they always needed with kids? Certain entities would say yes, they're always needed. If you have a bullseye rash, which ILADS considers to be fully diagnostic for Lyme disease. In other words, if you get a bullseye rash, no matter what bit you, you don't need to go get a test. Just treat it. And those of us who work in more of the holistic space, we use herbal formulas, and the ones that we use are very effective. And so many people who feel comfortable going that route can actually use very safe and effective herbal formulas. So when kids come to see us with new tick bites, we use the herbal formulas. If the parent wants to, they can go to their doctor. They will generally prescribe amoxicillin if they're 8 years old or younger for the fear of the teeth staining. But then the doxycycline is really the antibiotic of choice for Lyme disease. And so they will dose it in kids generally, and every doctor's different, because some will do it even younger than 8 years old because they say we don't see the teeth staining, but others want to avoid it. The doxycycline is more effective than the amoxicillin, and sometimes azithromycin is used as well. Now, some parents just really don't want to use antibiotics. They want to keep that good bacteria. They're onto this. They understand. And so doing the holistic Lyme treatment is a really great option for them. And we're very excited to help educate them around how they can do that.
So here at Foundations Wellness, we take a holistic approach to pediatric Lyme disease coaching and education. And that involves a whole realm of things, really. We look at the child as a whole, and we utilize herbal treatment for Lyme disease. So herbs that are natural, safe, and effective. It's been proven in the studies that herbs are effective at killing Lyme disease. But at the same time, we need to support the immune system. So we put a big focus on supporting the immune system, building immune resilience. We focus on some detox, which is key to really getting to the bottom of and getting rid of Lyme disease. So we do foot baths, and we also put a focus on binders to really attach to the Lyme bacteria and help the body rid it. And those are just a few of the ways that we utilize, education and coaching around Lyme disease here at Foundations Wellness. Teresa, tell us a little bit about what we do to build immune resilience here.
Yeah, I was going to piggyback on what you were saying and talk that, the conversation that I have with adults all the time is that the Lyme disease bug, yes, is a huge part of the problem, and we take it very seriously here, and we have some excellent cutting edge solutions for that. But it's not really all about the bug. Not really. It's about your immune system's ability to get on top of it. And so that's why some of the things that we do here from a holistic standpoint, just helping to improve the microbiome, diversifying the gut bacteria, diversifying the bacteria in the body. So we use just nutritional sources for that, and also getting rid of anything that could be impairing your immune system's ability to get on top of Lyme, like mold, or pesticide and herbicide coming through food and water, heavy metals, many different environmental toxins, plastics, anything that could possibly interfere with the immune system staying in remission. Because that's the thing that terrifies parents the most, I think, is I don't want my child to be set up to be sick for the rest of their life. And so the conversation we have all the time is you really don't have to worry about that if you are using safe and effective herbs in combination with immune system strengthening modalities. And I really love the processes that we use here.
That's right. So few people really know how to help kids recover from Lyme disease. But here at Foundations Wellness, that is what we are passionate about. We have lots of education and knowledge around that, and we look forward to sharing that with you and your family.